Thank you for joining today's briefing from the St. Louis Metropolitan Pandemic Task Force. In the past few weeks, we've told you that the situation with the COVID pandemic was getting more and more dangerous, and today we're seeing the impact of those trends. All across the country, case rates are rising rapidly, especially in the Midwest and South, as the highly contagious Delta variant sweeps through the country. Information from other countries is now telling us that the Delta variant is 2 to 3 times as likely to put an individual who's unvaccinated in the hospital and twice as likely to result in death. Those are scary odds, even more so when you consider the fact that they're avoidable if we take appropriate steps. In St. Louis, the number of people who are so sick that, with COVID that they need to be hospitalized is now 4 times what it was just 6 weeks ago at the beginning of the summer. That's more cases than we've had at any point since the middle of February, and nearly as many cases as we had in the original surge of Delta when we didn't have a vaccine and we knew so little about it. Those facts are shocking and disheartening as we think about the preventability of many of the cases we're currently seeing. Our nurses, our doctors, our therapists, all of those who work in healthcare, and even the facilities that we deliver healthcare in are getting stretched, and we can't sustain the current rate of increase. As more and more cases accumulate, we know we will start having to make adjustments in other types of care that we deliver to the community. And that's why we're urgently appealing to the community to support us by wearing masks and getting vaccinated. We know that this is frustrating. No one's more frustrated than we are, especially as we see our emergency departments, our hospital beds, and our ICUs fill with COVID patients, patients who, had they been vaccinated, likely wouldn't be there. We know this may appear to be a step backwards, but it's not. We are making educated, proven, and critical adjustments to how we're combating COVID because it's escalating in our communities and it's currently spreading too easily. Further, we have to recognize that Delta may not be the last variant we face. Viruses are constantly mutating, and as long as there is a large number of unvaccinated, non-immune individuals in the population, we're set up for new virus forms to emerge, ones that may be more contagious or more deadly than Delta, and most disturbingly, ones that may actually escape vaccine-induced immunity. Currently, we're sitting at just under 42% of our population is fully vaccinated. About 46% have had 1 or more doses of vaccine, and that's way short of where we need to be. In order to stop transmission once and for all, we're going to need immunity levels that are in the 80 to 90% range, based on how contagious Delta is. We have a long way to go. Before I go over today's numbers, I want to issue an urgent plea to everyone in the community. If you're not yet vaccinated, this is the time to do it. In fact, it is past time. Don't wait any longer and take chances that you'll wind up like many who are hospitalized or in our intensive care units. You need to get vaccinated to stave that off. We hear a lot of people justify not getting vaccinated because they say that COVID is just like a cold. And for some people that may be right, particularly if you're young and healthy. The odds are if you get COVID, it may be just like a cold. You may not feel like you've really had a very tough illness, but that may not be the case either. We are increasingly seeing more young people who are being admitted to hospital and becoming critically ill. And you could be one of those unfortunate few if you are unvaccinated and get COVID. Saying the virus is a minor illness and feeling invincible is just not a very good strategy for protecting you from what might be a serious illness. And it isn't just you that is being protected when you wear a mask and get vaccinated. You're also protecting others who are more vulnerable, either because they have something that compromises their immune system or because they can't be vaccinated. Currently, kids that are 11 and under aren't eligible for the vaccine. And wearing a mask and getting vaccinated is the best way we can protect them from becoming ill. It's true that Children typically don't have a very rough time with COVID. Many weather it with minor symptoms. Again, not much worse than a cold, but not all of them do. And one thing that we're seeing here in St. Louis and is being recognized across the country is the increasing number of kids who are very ill with COVID. We've gone in just a week from having 13 kids in pediatric hospital beds with COVID to 20 this week, many of whom are in critical condition in our intensive care units. So vaccinating may not be just something that you do for yourself, but think of it as something you can do to protect others who are more vulnerable. There's also another aspect of protecting children that we need to recognize, and that is that kids have become an important source of spread. So in a number of outbreaks that we've experienced in this area, as well as other parts of the country, children who are unvaccinated have become the point source for further outbreaks as they acquire the disease in a summer camp, say, and then go back and spread it to vulnerable family members at home. We can help prevent that by masking and vaccinating ourselves and by having our kids wear masks in the right setting, such as when they return to school in the fall. Another vulnerable population that we really need to pay attention to are expectant moms. Last week, the American College of Obstetricians and Gynecologists, as well as the Society for Maternal Fetal Medicine, announced their recommendation that all women who are pregnant or breastfeeding receive a vaccination if they haven't already done so. That recommendation is based on two things. First of all, the thousands and thousands of women who are pregnant or breastfeeding who have already been vaccinated, showing that the vaccine is safe and effective in those populations. And second, the growing experience with pregnant women who are landing in the hospital and in intensive care units who haven't been vaccinated. That's a disastrous outcome, and it illustrates the second reason that the American College and the Society have made the recommendation about vaccination. COVID can be a deadly disease for a pregnant mother. In just the last 6 weeks, in one of our task force hospitals, there have been 10 women admitted to intensive care unit who are pregnant. Being sick with COVID during pregnancy can lead to preterm delivery, to complications, intensive care unit stay, as it has in these 10 women, and in some cases, death of the mom before she has a chance to meet her infant. So it's another group that we must do everything we can to protect, which includes vaccinations wherever possible. These are harsh, raw truths, but they paint the situation as we're seeing it now. No one's immune to the terrible physical, emotional, or economic impact of COVID. So I'm going to close this part of the talk by urging once again faith and business leaders to have conversations with their congregations or their staffs. You may be the only person they listen to, so please join us in being part of the solution by encouraging those around you to be vaccinated. We've given up a lot of ground to the coronavirus since the spring, and we're continuing to lose ground at present. The virus is continuing its march forward. If we lose any more time through vaccine misinformation or hesitancy, more people are going to get sick, more people are going to wind up in the hospital, and more people will die. So with that overview, let's move on to looking at the numbers for today. The first graphic shows the epidemic curve. This is the total number of people reported each day with new cases. And again, at the far right, we see the recent days showing the acceleration in the number of cases. This graph shows the week-over-week change in reported cases. Once again, 37% increase week over week. That number has stayed in double digits for a number of weeks now and speaks to a rising proportion of the population who are ill with COVID. Another way to look at that is the reproduction number with which many of you are familiar. Again, when this number is above 1, It means that the number of people with COVID is expanding, and we have to get it below 1 to see the disease start to recede. In terms of new COVID hospitalizations, we had 63 new admissions day before yesterday, with a 7-day average of 71 and rising. So again, this is a pretty sharp uptick. You can compare it to the rise that we saw last October and November, and we haven't seen any change in that slope so far. Currently, we have 439 patients in hospital with COVID, 123 in the ICU and 65 on ventilators. And just as a stark reminder, many of those individuals will not survive that ventilator episode. Overall, our increase in census is continuing up. This is the graphic over time. Again, you can see that our 7-day moving average is 420. We're getting very close to 50% of where we got to in October and November, and we haven't seen the curve start to bend yet. So we're continuing to see this escalate. Among those who are currently hospitalized, 84 are unvaccinated. We have 16% of current hospital stays that are fully vaccinated, but many of those individuals are in for other reasons, and COVID's been detected incidentally, or they have compromised immune systems, and their illness from COVID is coming as a result of that compromise. We've already talked about the fact that many more kids are being seriously ill with COVID, including in the St. Louis Task Force hospitals, 10 children ages 11 and under, and 10 children who are 12 and over, several of which in each age bracket are in ICUs fighting for their lives. One question that's frequently asked is what the road ahead looks like. I think everyone would like to have a crystal ball and see where we're going to be. One look we can get at that is by comparing what's happening here to what happened in southwest Missouri. The graphic on the left shows the total number of cases over time in those two regions, and is informative just in the total numbers of cases. Of course, the St. Louis area, having a denser population, had many more cases numerically. If you look at the number of cases per 100,000 citizens, the curves are more similar, a little ragged at the top, but more or less they showed the same up and down. And then more recently, you can see the case rate in southwest Missouri as the Delta variant took hold. The orange graphic on the far right shows the St. Louis metropolitan rate and the upswing that we are experiencing. Just for comparison purposes, those two lines are about 6 weeks apart. So we currently appear to be on a very similar trajectory to southwest Missouri. Of course, our way out of this ultimately is through vaccination. And in Missouri Region C, about 52% of those individuals who are 18 and older have completed their vaccination. It's way short of where we need to be, although the number is increasing. This graphic, which you can look at in more detail on your own, shows the breakdown by county across the entire metropolitan area. Each of the counties on the top half are on the Missouri side, and the bottom half represent the Metro East side. No county has more than 48% of their population that's been totally immunized. Most are in the 30s, and we have some counties that have fewer than 30% of their population totally immunized. Certainly, some are doing better than others, St. Charles and St. Louis County and Monroe County, but none are in the place where we need them to be to halt spread. This is a more detailed look of Missouri Region C by zip code on the right and by county on the left. The darker the map, the higher the vaccination rate. So it's fairly easy to see where vaccines are being used aggressively and where we're lagging behind, particularly in North City and North County of St. Louis, and in some of the more outlying regions of the Missouri Region C. We're also continuing to see an increase in the number of beds occupied with COVID patients. This shows that 7.5% of the regular hospital beds have COVID cases and 50% of ICU beds. Some hospitals are significantly higher than that, which is really crowding out other types of care that need to be delivered. And finally, we have continue to have a brisk number of discharges from hospitals. We're now up to a total of over 24,000 individuals who've been discharged alive from task force hospitals, which is a wonderful reminder that the healthcare system can help people recover, but not everyone recovers. A number of people do have so-called long COVID symptoms that are persisting, and many for now months and months past their original illness. The other unfortunate outcome, of course, is death. And in task force hospitals alone, we've had nearly 2,300 deaths since the beginning of the pandemic, over 5,000 in the metropolitan area. And as we've discussed before, the death rates, which are a lagging indicator, are now starting to move up, and our 7-day moving average is 6 new deaths a day and climbing. In summary, I think it's safe to say that the situation is getting worse. Healthcare system is getting more stressed, and we're having more of our citizens who are succumbing to what is essentially a vaccine preventable condition. It also tells us that we're some weeks away from seeing a change in this status. Even if everyone who is eligible for a vaccine gets it now, it will take weeks before that increased vaccination rate will take effect. And in the meantime, we'll have to rely on masking to prevent spread. But even so, we know that the case rates will continue to rise, likely for at least the next 6 weeks. If we can increase our vaccination rates, we will save lives, we will help our communities open up, and we'll keep our economy going. If we don't increase the number of vaccinations, if we don't use masks appropriately, the virus is going to keep winning. Hospitals will get stretched further and further beyond their capacity. Other healthcare needs will go unmet, and a lot of unvaccinated individuals will become ill, some seriously so, and some will die. The important thing to remember is we can change that outcome. We know how to change it for individuals and for communities. We just have to take these simple steps right now. So please, wear a mask, get your vaccination. Thank you.